And we're back.
Yes, we are.
We're back when you look like you're 18 and he's an OB-GYN.
I know. He's very, very young. First of all, forget about OB-GYN stuff. Tell us how come you look so young. What are you doing to look...
Why don't we introduce him?
Oh, I'm sorry. That's a good idea.
Wow.
It
shows off control.
Look how he's adorable. He's youthful looking. I want the secrets.
Oh, this is what I'm saying. This is going to be an interesting set.
That's right. Dr. Arcelin.
That's correct.
How do you pronounce your first name? Gostal?
Gostal.
Gostal. Where are you from?
Well, I've moved around a lot, but I grew up in Montreal. My dad is from Haiti, and my mom is from Spain.
Okay, so what's the secret? Because I am telling you, you walked in, he thought you
guess it's probably genetics.
Oh my God, unbelievable.
He's 21.
I know. At least he looks that way.
No, I'm 44, yeah.
That is incredible. Yeah, you're going to have to come up with some good secrets for us. All right, so we're going to talk about an issue that a lot of women experience, fibroids. I actually had a fibroid. What causes a fibroid?
Well, in reality, we don't really know what causes fibroids.
Well, my doctor did, but anyway.
Oh, really? I'd like to hear his explanation.
It's really next.
Yeah, it's very common. About 50% of women have fibroids. Most women who have fibroids don't know they have fibroids because they're mostly asymptomatic. They don't cause issues or problems, but sometimes, depending on their locations or if they start growing, they can cause a lot of problems and cause a lot of havoc in a woman's life.
Are fibroids dense? I mean,
fibroids are basically benign tumors. Their growth, the uterus is made up of smooth muscle cells, and they're benign tumors. They're fairly dense. Sometimes they can get calcified and get hardened. Depending on their location within the uterus, sometimes can cause bleeding, irregularities, lots of
I guess what I'm asking is, can they make you put on, or can you seem to put on, do they weigh something? So you get on the scale and it's a couple extra pounds, get rid of that fibroid.
It's true, but I mean, not really. I mean, when we remove large fibroids, I mean, yes, they can be massive, and sometimes they can weigh several pounds, but I'm not sure it's something you would really notice, if you weigh yourself. I mean, you would probably lose a pound, depending on how big the fibroid is.
So really, just
most of the time, it's not really a weight issue.
She gained the pound and she thinks,
I'm wondering about it.
Blame it on the fibroid.
Blame it on that fibroid. Well, what I understood was that fibroids kind of feed on estrogen. That was what I was told.
Well, that's true. Most women who have problems with fibroids are usually, before menopause, and we know that estrogen tends to make them grow a little bit, and after menopause, the fibroids will tend to get smaller or shrink to a certain degree.
Is there any danger with fibroids?
Not generally. It's very rare. 1 in thousands of fibroids sometimes turn into cancers. So there's no real medical danger to it. Sometimes can cause quite a lot of bleeding, pain.
I think somebody said if they're like towards the back.
Well, there's different locations. If they're within inside the uterus where the baby would grow potentially, if they're located there, they cause a lot of bleeding and pain and dysfunctional uterine.
Could they be mistaken for a pregnancy?
No. I mean, sometimes if you examine the patient, sometimes they can get big enough so that the woman will sometimes look as if she's in early pregnancy, but no.
So what do you do?
There's a procedure that you do to remove it, which is the crux of this thing.
Right. What we're focusing on is what we call minimally invasive surgery these days of how to treat fibroids. I mean, classically, the most common surgery in the United States has always been hysterectomies, and it continues to be, and it's usually due to fibroids or things related to that. Unfortunately, most hysterectomies these days are done the traditional way, which usually involves an incision on the abdomen, a little bit like a C-section incision, and the recovery can be, 6 to 8 weeks long. We've been focusing on minimally invasive surgery. We do a lot of what we would call robotic surgery or laparoscopic surgery to remove either the fibroids without doing a hysterectomy, or sometimes we need to do a hysterectomy, but this minimally invasive surgery allows you to remove the fibroid with a much improved recovery time.
Robotics are inserted into the body, yes?
Well, what we call robotic surgery, it's a little bit an extension of what laparoscopic surgery is. It's little tiny incisions that are made on the abdomen, and what we do is these instruments go inside the uterus, and we really sit at a kind of a computer monitor that has vision, and it also has these little remote handles that go on our hands. And whatever our hands are doing, the computer through those instruments that are inside the belly will move, so if I move my hand left, the little instrument will go left. It's actually extremely precise. It's almost...
How hard is it to kind of get the
hang of it and so forth? I guess it depends on the person. It's very similar to, PlayStation games and so forth. So I guess if you're... If you're good,
have PlayStation surgery.
If you're a little bit good with laparoscopy or instruments, you're probably pretty good at, the machine of the daVinci is really very intuitive. It's actually, they made it very, it's not too hard to get real comfortable with it. So much so that, I'm almost more comfortable with it, with the daVinci robot than, sometimes when we do an open case, we get better visualization, better control, we see better, there's less blood loss, there's lots of advantages.
So when you do that surgery, I've never been in a daVinci suite. Are you actually in the room with the patient, or are you,
we're in the same room. Theoretically, you could really be anywhere in the world. And I think initially...
so no scrubbing in?
Exactly, you don't need to scrub in. We still do, because we do parts. We have to place the instruments, so we have to scrub in for that part. But once the instruments are placed and the robot is docked to the patient, we can be at a console or at the computer. I think when the robot was developed, I think the idea initially was for the surgeons to operate remotely, a little bit like the drones for the military, and I think that's what was the idea initially. But so theoretically, we can be anywhere in either next room or miles away. But we are in the same room. Yeah.
That's like what we do. We can televise from miles and miles away.
I know, but it's not,
it's not like with that, if I understand that. How long has the procedure been available?
It's been available, I don't know the exact date that it's been available in the U.S. Over the past 5 years is when it's really started to be used to a much greater extent. Different specialties have used it more. The ones that use it the most so far have the most use of it that has been the OBGYNs.
So the recovery for this kind of procedure versus a traditional would be a lot shorter?
It's a lot shorter. With a traditional surgery, usually you stay hospitalized about 3 or 4 nights. With laparoscopic surgery and robotic surgery, some patients go home that same day. Sometimes, most patients stay probably 1 night. It depends a little bit on the practice.
So prognosis-wise, as far as the fibroid goes, once you remove it through a procedure like this, what are the odds it's going to come back?
Well, when we just remove the fibroids, which is called the myomectomy, usually it depends on the situation, because some women will just have one single fibroid, some women will have many that vary in different sizes. So it depends a little bit on how many there are to start with and so forth. Most of the time, repeat operations 5 to 10 years down the road for the same issue is anywhere from 20 to 30% or so.
That's not really bad. Okay, well, sounds like an interesting idea. I'll be signing up.
God forbid.
No, God forbid. I think I'm not feeding it anymore, shall we say. If somebody wants to get hold of you and have a consult on something like this, what would they have to do?
They can call my office. I also work, I do most of my surgeries at West Boca Medical Center. Okay. They can also, I'm a physician at Women's Health Partners, so they can also get in contact with us there. It's a private practice. Okay. We're in a group practice. We have 2 offices, one in Boca and another one in Boynton Beach.
Is there a website?
There is a website. It's www.myobgynoffice.com.
That's brilliant.
That's fairly easy to remember.
myobgynoffice.com. What's your phone number?
It's the main phone number of our Boca office is 561-368-3775.
Beautiful.
Excellent.
Well, Dr. Arcelin, thank you so much. It's a pleasure.
Yeah,
You didn't tell us fountain of youth secrets, though. I guess it's just genes.
We have to call to find out.
Right, I have to talk to his parents. Thank you so much, Dr.
It's been a pleasure.
All right, let's take a break. We'll be back at our final segment. That's probably for you, that phone call. All right, we'll be right back.